guys, it's Dr. Alyssa here, and we're going to be talking about chiropractic care for seniors today. Um, so a little bit about who I am. Like I said, I'm Dr. Alyssa. I've been a chiropractor for 6 years, and this is my third year at Live Your Life Chiropractic. I really love seeing whole families from babies all the way up to the grandparents or the great grandparents even. But I have really increased my patient population, I would say, in the last year or so, to help senior citizens. And I've been really enjoying this avenue of chiropractic care. Um, Today we're going to be covering a term that I'm going to call aging healthy and some of these really common issues that affect seniors and how chiropractic care can help them. Um, so the first thing we're going to talk about is just a bunch of these age-related conditions, issues, whatever you want to call them. So the first one that I get most of my complaints about are joint stiffness and decreased flexibility. There are several reasons why this happens. And the first one being that we just lose cartilage, synovial fluid, blood flow, and muscle mass and strength as time goes on. So cartilage is the cushions in our joints. These just start to wear down as we get older. It can't be prevented. Everyone goes through it. And this is what causes that pain and stiffness deep in the joints and eventually the term osteoarthritis, which we'll talk about a little bit later. Synovial fluid is the lubrication in our joints. This fluid level just decreases as time goes on and as we get older. And this is what causes the friction in our joints. So that kind of overuse sensation in our joints. So like really common in knees to lose that and in elbows. And then blood flow also decreases. Our veins start to constrict a little bit more, our veins and arteries, and this is the delivery system for the nutrients to the joints. So if we're not getting as many nutrients in the joints, they're going to start affecting our tissues, and our tissues around the joint, like our tendons and ligaments, are going to become dehydrated essentially. And this um, makes the joint in general become less healthy and less flexible when the surrounding soft tissue um, is affected. So, and then the muscle mass and strength, we gradually lose muscle mass. And even if you lift and stuff, you're still not going to be gaining the same amount of muscle mass at 18 as you are at 68. So, this mainly affects joint stability. So the sensation of feeling weaker or that your shoulder is going to dislocate or your hip is going to go out, that's because the muscle in the area isn't as strong and it can't hold on to that joint as well as it used to. And that, so if you feel less stable, then you're going to move less, and that's going to affect your mobility and flexibility. I already mentioned the connective tissue a second ago with the blood flow, but we also decrease collagen as time goes on too. And that makes the elasticity properties of our tendons and ligaments to decrease. And then it just makes them less resilient. So you're more prone to tears, like micro tears or full tears. And that can also affect the overall health of our joint. Another big issue I hear from my senior patients is the risk of falling or having poor balance. So, risk of falling is contributed to a bunch of different things: physical factors, environmental factors, brain and cognitive factors, but we're going to be mostly focusing on the physical ones today. So we already talked about how our muscles aren't as strong as before. So this muscle weakness, strength naturally decreases over time. And as our strength gets weaker, that causes posture changes and just an overall weakness to support our bodies. So, nothing we can do about this is except for trying to continue the strength as much as we can. But the posture changes are usually the biggest reason, and we got kind of that like forward lean posture going on, and that changes your center of gravity, making it harder to stay on your feet. Um, Sensory function also decreases. So like our vision, as you get older, eyesight just starts to go. You can also get more issues like those cataracts or macular degeneration. But that will start to affect your depth perception, making it also harder to keep balance when you feel like a step is closer or farther away than it actually is. Um, and it also makes it harder to see obstacles, especially distance. Distance vision definitely starts to go as we get older. And if you think that there's no obstacle in front of you because you can't really see it, that also increases the chance of falling because you're not seeing it clearly. Hearing is also one that can be affected. Our sensation in our ears starts to get impaired as we get older, especially higher frequency sounds. That's usually the first one to go. So those really high pitched sounds, a lot of my patients tell me that they can't hear me because I talk, my frequency is harder on the ears to hear. But it also affects the sounds around you. And a lot of times it's easier to get startled, right? Because you can't hear someone coming up on you. And that can cause a stumble here and there as well. Um, Proprioception is a really fancy word for the body's ability to sense how it is in position in space. So, as your proprioception decreases, you're gonna not, again, you're gonna be like, whoa, is that closer or farther away than I actually think it is? And that affects your coordination and balance. There's lots of chronic pain conditions that affect us as we get older, and not everybody has all of these things, but you could have a combo of some of the ones that I'm going to talk about. Um, the biggest one, like I said, is probably osteoarthritis, and that's that cartilage breakdown in our joints, which can cause pain, swelling, stiffness. It often affects more of like the overuse joints, like the weight-bearing joints, like our knees, our hips, the spine. And then nowadays we're seeing a lot more people with typing and thumb issues because of all the amount of times we're spending on computers and the overuse in the cartilage in our thumbs and wrists. Rheumatoid arthritis is another, probably the second most common arthritis, but it is considered an autoimmune condition. So you have to have the right inflammatory markers to have rheumatoid arthritis. But essentially, rheumatoid, um, your immune system attacks your healthy joints, and this is the much more inflamed process compared to osteoarthritis. So you're going to get lots of inflammation, and this can actually break down your joints and causing them to deform, and they're not supposed to look the way that they end up looking. Um, this is more common in your hands and feet usually, and wrists. Because it affects the actual shape of your joint, this really leads to the stiffness and reduced range of motion because your joint isn't shaped how it used to be. And then another interesting thing about rheumatoid is that you get these flare-ups that can kind of ebb and flow. So you're not always going to be inflamed, but you will have more flare-ups versus osteoarthritis kind of just being like a steady progressively getting worse kind of thing. Back pain is another big chronic pain issue, especially in the lower back. This is probably because of osteoarthritis that happens in your lower back first. It also can spread into your disc, so in those cushions in your spine called degenerative disc disease. And as the breakdown of the joint is happening, it can also cause spinal stenosis or the narrowing of your spinal canal. And if you start to get narrowing, then it can lead to more disc issues like herniations or bulges or slip discs. Neuropathy is another big one that I feel like affects senior citizens a lot. This is just the damage of your peripheral nerves. So those are the nerves that go the farthest away from your spine. Um, Diabetes is the most common cause, but other conditions can also cause it, like vitamin deficiencies, overuse, shingles. that kind of stuff. Neuropathy usually presents itself as like a burning, stabbing, or like pins and needle type of pain. And it's most common in the hands and feet because those are the furthest nerves away from your actual spinal cord. Sciatica is another big one. This is kind of like a combo between the low back pain and neuropathy because it's affecting a nerve, but it's usually because of like a herniation or the loss of space in the lower back that's like pinching and causing that neuropathy on your sciatic nerve. The pain usually only affects one side of the body, but it can affect both, and it's usually that back of the leg down to your feet kind of pain. Um, Chronic migraines and tension headaches are also common in seniors. This tension headaches can be caused by a number of things, but the biggest ones are stress, poor posture, and dehydration. So, um, that poor posture aspect of it as our bodies are changing as we get older, that is what usually increases the tension headaches, and those are more like the headband across your forehead and back of your skull kind of headaches. But they also can cause like a sensitivity to light, sound, and um, also have some nausea and feeling like you just need to be in a dark room all day and then you can't do all of your other daily activities. Pelvic pain is also a really common one. Probably I would say more common in older women because of having menstrual cycles and having most likely having a baby or two because that can cause the pelvic floor dysfunction and um, our abilities to hold our bladders as we get older also um, the tone in our bladder starts to decrease. So it gives us more bladder issues like interstitial cystitis or chronic UTIs or chronic bladder infections. This really decreases quality of life because it's just uncomfortable to sit, stand, move, and it also affects your sexual health. Um, and once the sexual health stuff starts to go, it affects emotional well-beings and this is a big factor for a lot of people. So chiropractic care for seniors is a super effective treatment option, especially for those chronic conditions. And that's related to musculoskeletal pain and mobility issues. Um, So, especially on the spine and pelvis, we can help with diagnosing those skeletal factors. And then if those start to improve, all the other things should also start to improve, like mobility, flexibility, um, urgency, all those kinds of things. So how it can actually help, the obvious one is relief from joint and back pain. If you start to feel better, joint wise, life is going to improve. Your quality of life is going to improve. So specific chiropractic adjustments, can help relieve the pressure on the nerves. Once those joints are kind of sitting more where they should be, it reduces the inflammation and it gives you that better movement. Um, Muscle spasms are also common with back pain. I always tell patients it's like chicken or the egg. Is it the spine being out of alignment that's causing muscular tension, or is it muscular tension that's pulling the spine out of alignment? Either way, both are being affected. Excuse me. So getting those muscle spasms to calm down will also help alleviate that back pain. Um, a lot of patients will notice that they've had a lot more improvement in mobility and flexibility, and that's just because the joints are moving how they should. Even if we have that decrease in synovial fluid and the cartilage is decreasing, if we're enhancing the way that the joint moves to the best of its physical ability, you're going to notice improvements in mobility and your flexibility. So this is, performing your daily tasks, walking, getting in and out of a chair, getting in and out of your car, off of your bed, bending forward to get something, reaching high up to get something, all those things will start to improve. Um, this is a big one for a lot of my patients is the pain management without being on more medications. So a lot of times when we're older, we're taking multiple medications and people don't like to take more than they have to, and especially when it's a pain medication. So a lot of these chronic conditions can be treated as a non-invasive drug-free approach, and this helps with the reliance on medications and potentially the side effects of them as well. Posture can improve, which is helping with that poor balance and proprioception. So, if we get good improvements in posture by working on stretching and muscular health and getting those joints sitting kind of where they should be, it's going to put an overall better spinal alignment, which is going to improve your posture. You're going to stand up a little taller. You're going to be able to draw those shoulders back better. And this really does help with the risk of falling. And then that kind of ties into the other one is the better balance. So realigning the spine and pelvis enhances that nervous system, which enhances that proprioception, which is crucial for balance. And then we often will talk through like a little exercise program to strengthen your core. So you're not pulling yourself forward anymore and you're not losing that body sense of position. Another thing that chiropractic care can help with is that improved circulation. So we can't physically help the size of our arteries and veins, but we can help with how the body is flowing through them by reducing the nerve interference in the body. And this will take off the interference of the circulatory system as well. So better circulation helps with the inflammation, and then you can you can heal faster because you're having better blood flow, which is taking in those good nutrients to your joints and taking away the bad ones. Headache relief. I get a lot of really good results of relieving the neck and upper back with these tension headaches or these migraines. Um, Manipulations, we'll talk about this in a second too, can be, manual or instrument assisted or anything, but just performing adjustments on the neck and upper back really do help realign that area to take off that extra tension from stress and posture to really keep those headaches at a minimum. So I always tell people my goal is to reduce your frequency and the intensity of which you're getting headaches. Um, and then stress relief and also overall mental well-being. With chronic pain, if you start to feel better physically, you're going to start feeling better mentally. So this can help with, having less stress and anxiety and depression. If you can get up and moving and in the sunshine, that's all going to help with your overall being. Um, and we can also talk about stretching and how to relieve those muscles when they do start hurting so that you can improve that mood. So there are some special considerations when it comes to adjusting seniors. Um, the very first thing I do is talk about your comprehensive health, because there's often a lot of health issues, um, that go along with the longer that you live. So if we're not talking about every little thing and you're going to be like, why does this matter that we're talking about my heart health when I'm here to see a chiropractor? Well, it's just an important thing to kind of get the full picture of who the person is. So getting that really good medical history, getting a list of every medication that you're taking, if you've had any recent injuries or surgeries, routine or not. And this helps us determine if there is any contraindications for chiropractic care. So like having a recent stroke, you don't want to do any manual manipulations to the neck. If you're prone to osteoporosis or if you've had any recent fractures, you don't want to push too hard and you might want to do instrument adjusting instead. And this helps just really tailor specific needs to every single patient. So this doesn't look the same for everybody. It actually looks vastly different for every single person who walks in. I'm a big believer of the gentle and low impact techniques, and I get a ton of really good results from not doing kind of like the stereotypical manual adjustment on seniors. Um, we lose bone density as we get older, and we already talked about how the tissues are weaker, in the ligaments and tendons. So with that decreased flexibility already, you're more susceptible to injury. Gentle low impact techniques won't have any of that crazy rotating or pulsing. And it just decreases the risk of further injury. So examples of low force techniques are like the drop table, where I'm tuning the drop so I'm only putting enough pressure into your body specifically. The activator is a great technique for seniors because it's instrument adjusting. It's a super specific contact point, and the force is also controllable on that. Soft tissue therapy is good, like gentle muscle mobilizations, similar to massage. Um, and these are all helping those joints get a little more movement and lubrication in them without a high intensity kind of adjustment. Osteoporosis is definitely the biggest contraindication. This is where bones are weak and brittle. Most affected are postmenopausal women, and you definitely want to avoid the aggressive spinal thrust and manual techniques on these kinds of patients, and that's why that comprehensive health assessment is so important. But there are still definitely ways to get gentle manipulations and mobilizations into their spine and helping that joint health get as strong as possible. Um, you also have to think about how a mobile a person is. And not everyone can lay face down on a table or face up or on their side. So if you have limited mobility, there are still ways to help you with a chiropractic mobilization versus adjustment. And these can be supported with cushions, pillows, doing it in a chair, doing it standing. I have a lot of patients who like me to raise my table all the way up and they just kind of hold themselves up on the table versus laying all the way down. And then we can always talk about a specific mobility exercise that helps you increase your mobility so that you could lay down for a full adjustment. So now we're going to talk about aging healthy. So there's lots of ways that we can help ourselves be healthy all the way through our lifetimes. Um, the very first one is just try to stay physically active. Regular physical activity can really help prevent or manage chronic conditions that are already in place. So I've been kind of beating the horse on the head with improved mobility um and staying flexible and that kind of stuff, but this is how you do it, is staying active. So because we lose muscle mass, if we're not working out our muscles, the more you lose it or the more you don't use it, the more you lose it. So by maintaining any kind of muscle mass, by doing even just a little bit of resistance work or mild weightlifting, it's really going to help maintain that muscle mass so that you can stay as strong as possible. And research has been showing that if you do weight training, your bone density scans are better. So doing a little bit of weight training um, and resistance band work will really help with your bone density as well. Aerobic exercises are great, and there's a lot of ways to do them without like having to go to CrossFit or anything crazy like that. You can take a walk around the park. You can um, take your dog for a walk. You can walk up and down some stairs. Swimming is a really great aerobic exercise that works out your full body. That's really easy on your joints. So if you're already having a lot of joint pain, I always recommend pool workouts because it takes off all of the gravity of being on like a concrete floor. Cycling is also a really low impact, great aerobic workout that really just keeps movement going, especially in your lower body. I already touched on the strength training, and balance training is also really important. So, a big one would be like Tai Chi or yoga, that you have to hold certain poses and keep that balance for, 15 to 20 seconds. Um, if you're working out, stretching is important so that you're incorporating your flexibility, and keeping the joints as limber as possible to help reduce that risk of injury. Research shows that you should aim for at least 150 minutes of moderate intensity exercise each week. Moderate intensity is what your heart is beating at. So, on an average person, our heart beats between 70 and 90 times per minute. So, to be up in the moderate range, you want to get that heart rate up to at least 120. Um, and then, or doing less minutes but more vigorous and trying to get that heart beating up to like 145, 150 beats per minute for 75 minutes a week. Eating a nutritious and well-balanced diet helps keep staying healthy as we get older as well. Um, it's really important for your immune system to eat a well-balanced diet. It also helps your brain health. Omegas are really popular in fish oil to help promote brain health as we get older. Um, Weight gain is also something that happens because we're losing muscle mass and then we tend to gain fat in the meantime. So if we're really working on a nice nutritious diet, it's going to help prevent any of that extra weight gain, and it reduces the other chronic diseases like heart disease and diabetes. You want to focus on a variety of things, fruits, veggies, grains, lean proteins is really important. So you don't want to eat any of the really fatty proteins, like pig and red meat. But like fish is a great lean one, poultry, chicken, turkey, those are all good ones. And then healthy fats like avocados, olive oil. A lot of the nuts have a lot of really healthy fats in them, and that helps just make sure you're kind of knocking off every macronutrient that there is. And you definitely want to avoid processed foods like excessive sugar and salt. Drinking lots of water is important throughout the day too. This is probably something that most people struggle with, and it's super important because it helps lubricate the joints as best as we can. So since we're already losing that synovial fluid in our bodies, staying hydrated helps maintain that level, that fluid level as much as possible. Um, Also, increasing foods that are rich in calcium, vitamin D, and magnesium help support those bones. And that helps a lot with not becoming osteoporotic or osteopenic. Um, and you can always talk about supplementing vitamins and minerals to kind of create that more well-balanced feel with a healthcare provider. Another super important thing besides the physical health is your mental and emotional health. Um, it's hard getting older. I think all of my senior patients tell me that getting older sucks. They tell me every single time I see them that getting older sucks and a new thing has happened because of just getting older. And if we have prioritizing mental and emotional health, that helps manage those stressful things of like another new thing coming up, another health thing coming up, another, family member getting sick or anything like that. So, and you definitely want to reduce the risk of depression and anxiety as we get older. Um, so positive mindset is something I talk a lot about. Um, Practicing being grateful for things. I every single morning I write at least three things that I'm grateful for and three things that I'm looking forward to, even in those super stressful times, because it helps you stay connected. If you have those little things that you're like, oh, that's wonderful. Like, I love the first, I will always write this one. I love the first sun hitting my face in the morning when I'm taking my dogs out to go to the bathroom. Um, if feelings of depression and loneliness and anxiety are getting overwhelming, please seek out a therapist or counseling that can offer that extra support. You're not at it alone, and it's so important to be able to talk to someone about those things if you're starting to feel overwhelmed in those depression feelings. It's also important for seniors as you like retire and you're not having to go places anymore to find something that you're passionate about that gets you out and being around other people. Socialization is the biggest reason that or the lack of socialization is the biggest reason that seniors start to feel that loneliness and then get more depressed and stuff. So really try to put something in your life that gives you that sense of camaraderie and purpose and gets you out and being a little bit more social. And then you can always manage your stress however you like to. There's lots of relaxation techniques or hobbies that you love, or going to see your grandkids or your great grandkids. All of those things will help manage stress. Another big issue is not prioritizing sleep and rest. So you want to have like a really good quality of sleep for physical and mental health. But I always tell everyone that sleep is the only time you're truly recovering. And if you're not sleeping well, you're not recovering well, and all of these things that kind of stack on top of each other are just going to keep happening. So really getting a good sleep is important. They say for older adults, you should be getting 6 to 7 hours of sleep a night at least, and that has to be uninterrupted. So if you're up and waking up and getting up and rolling over a lot, you're not really getting that good quality of sleep, which will also start to affect your memory, your mood, and your energy levels. Creating a consistent bedtime routine is super important for this. Going to bed at the same time each night. I am notoriously horrible at this, so I'm also need to preach this to myself. If you create a bedtime routine, you're going to make sure that your sleep environment is as consistent as possible, and then you're going to be more comfortable, and it leads to better rest. You should also try to avoid caffeine and heavier meals closer to bedtime, because, well, caffeine is explanatory, right? If you drink caffeine, it's going to keep you up a little bit longer, but heavy meals, it sits in your gut and you don't want to go to sleep with a full stomach because then the digestion part is really hard on your, it makes it harder to digest when you're sleeping. And then try to limit screen time. Again, I'm notoriously bad for this. I always am like falling asleep with my phone in my hand. But trying to improve the limit of it's mainly the black light or the blue light, excuse me, that affects it starts to fire in our brains and keeps us awake longer. If you have any sleep disorders, that is definitely something to talk to a healthcare provider about, um, like insomnia or sleep apnea, and discuss those different treatment options so that you're really getting that best quality rest that you can get. Um, if you stay active and have regular check-ins with your health goals, you're gonna age better. So having goals is important. If you want to be able to like walk a 5K, that should be something on your list, and that you're setting up regular things that are like, oh, I walked a mile today. Let's try to walk a mile and a quarter tomorrow, and really pushing yourself along to get to certain health goals. But they also have to be realistic. So wherever you're at, that's great. Set a realistic health goal. Even if it's, I had this one lady and it was so sweet. her only goal was to be able to get down onto the ground to play with her grandkids and then be able to stand back up. And we talked about, all the hip hinging and core workouts that we could so that she could do this. And when she did do that, we got to celebrate it. So really make sure we celebrate those small victories, which help us keep motivated. And then we can move on to another new goal after that. And then, of course, be kind to yourself, be flexible, be ready to adjust them. Your needs are going to change over time. And just keep aiming to be overall it better and then more improved. So that's all I have. I know that was a ton of information. If you have any questions, please contact me. And if you'd like to come up, we are also working with our health coach, Jen, so we can make really specific health goals for you, whether that's food, whether that's activity, whether it's a chronic health condition that you would like to see some improvement on. Please, please, please contact us and we can try to come up with the best care for you. And know that chiropractic is not scary for seniors. We can be very gentle about it, and I'm getting wonderful results of people who are able to do more Tai Chi and able to go on a longer walk with their grandkids in the stroller and just living these more healthy and active lifestyles. So it was great to chat with you all. And have a great day. And it's a happy holiday season from all of us at Live Your Life Chiropractic. Have a good one. Bye bye.